What's going on, everybody? My name is Jonathan Brescian, and today we have David with us. David just came through our training program just a few weeks ago. And he's a very cool story. David is an acupuncturist here in New York. And David, what's going on, man?
Hey, man.
How are you?
Good.
Good. So tell us a little bit about what's going on with your back and your knee before you started working with us.
Okay. So the first thing was the knee. I'll start with the knee just because it was much more chronic, much more long-standing. I think the knee was from an old yoga injury from probably, I think 2008 was probably the first year I ever did yoga and didn't know what I was doing and was probably doing a lot of stretches and exercises incorrectly and hurt where the front of the kneecap is where the location of the pain was. And then over the years, the pain would travel up the IT band, the side of my leg, into my hip flexor, into the top of my thigh, especially in the wintertime when it got cold due to, not to get into too much scientific jargon, but due to like the vasoconstriction, the narrowing of the blood vessels and the propensity to more inflammation in the wintertime. So especially in the wintertime, it would get never super painful, but very annoying and very consistently so. It was mostly very uncomfortable. And so that was the knee. It was the left knee. As far as the upper back went, it's a more recent thing, probably from occasional laziness and like poor posture. When I'm doing acupuncture, when I would have like a long day of work, I noticed, especially when we came out of the quarantine last year over the summer, during the pandemic, probably because I was so maybe just tight from being more sedentary, even though I was exercising, but still being relatively more sedentary, being at home and just doing a lot of desk work and probably hunching and then hunching over the table. I would get incredible tightness in between my scapula and in my upper back, to the point that every time I came out of the room from like treating a patient, needling a patient, I would come out and sort of just wanting to like arch my back. And it it felt so good, but I was like, kind of behaving like, a real embarrassment of an acupuncturist. It's like, I should know better, like really acting like a lay person, where it's like just these very like sort of lay person stretches, and never really bothering to get it treated by another acupuncturist, partially out of probably just my own laziness and also partially because of the pandemic. And so that was very annoying, especially at the end of work days on the upper back, but definitely tale of two conditions, because one of them being like 11 years old and the other being like about 1 year old, really.
Cool. What do you think some of the things that we worked on together when you were working with us were some of like the key pieces and the components that you were missing before you started?
I think so. First of all, I think the two most important things was the specificity of the one-on-one instruction. The exercises being specifically tailored to my pain and my condition, and also the kind of like weekly check-ins. Where it was like, there was like, little things where it was like, no, just move your hip like 3 inches to the left, or like, no, see that you're sort of like turning your foot in the wrong direction. And I could really like parallel it. It's a, like, perfect analogy to like, if you get acupuncture from someone from a bad acupuncturist, or even a not bad acupuncturist who's just having a bad day, if they're like 2 inches off the point location, the patient doesn't know. The patient's just like, oh, I just got acupuncture, it didn't work, whatever. But they were 2 inches off the point location, you just got a bad treatment. So if you're doing qigong or physical therapy, but you're not getting like the regular feedback, the regular corrections with that specificity, even though it's a little annoying some days, it's like, no, move your hand like 2 inches to the left. It can feel a little tedious, but it's the difference between an effective treatment and an ineffective treatment. So I think definitely that consistent guidance on just becoming a better qigong practitioner, is really what I feel made the difference for me. I feel like a better qigong practitioner now.
Gotcha. Awesome.
Yeah.
That's really cool. So like, how are things feeling now? Like, how's your knee? How's your upper back? Where are you at with that?
So the upper back is like, nil, like completely gone, completely 100%. I don't feel it at all. Now I still do the exercises as they pertain to the shoulder, because now who knows if it was related or not. From our perspective, it probably was, but in 2001 I dislocated my right shoulder. I never dislocated it since, but in learning the exercises, and as you were instructing me, like noticing the pop, and you know, the pop in the shoulder joint, especially more pronounced on the right side where I had dislocated my shoulder a long time ago. So I still do the shoulder exercises just as like maintenance, just as like a morning routine, knowing that like, hey, I'm 42 now, but one day I'm going to be 82, hopefully, and I want to prevent arthritis in my shoulders. But the upper back pain I don't feel, and actually my clinic is much busier also, thankfully, now than it was in the summer. So I'm leaning over the table. I'm treating more patients than I was 6 months ago. And I'm walking out of the treatment room with no pain in my upper back, which is super significant, right? So that's great. The knee is, I would say, it's probably like 90 to 95% better. I would say there are some days where I would say it's like 100% better. It's just such a long standing injury. The difference between the knee and the shoulder is the shoulder now, I'm doing the exercises preventatively. I don't feel like I need to do them. Whereas like the knee, because it's an 11-year, 12-year-old injury, I'm not in pain. I'm not feeling it at all, which is super awesome, because it's 30 degrees, 20 degrees outside. This is the prime time when I should be in the worst pain in my knee. And this is the best winter I've had as far as my knee goes in 10 years. But I'm still doing the knee exercises every day, because the knee I feel more vulnerable. The knee I feel like it needs the maintenance. So the shoulder I'm doing for prevention, the knee I'm doing for maintenance. I'm still doing the exercise quite often, but I would characterize it as 90 to 99% better.
Wow, that's
Yeah.
good to hear. Yeah, I mean that's kind of the trick, right? Like sometimes we feel like so much better. Do we still need to do the movements? But if you don't want to feel stuff later on, I guess it's worth doing it. It's always sort of like the give and take that we battle with once we're feeling like tip top.
So yeah, like the dentist filled my cavity, so I don't have to brush my teeth anymore.
Exactly.
Right? It's filled. It's done. I'm fixed.
Yeah, exactly. So I guess the last question is, if somebody was on the fence, they were thinking about joining, what's like one piece of advice that you'd give them?
I think what I would say is, as someone who, like, I've always been an exercise person. We all have our sort of flaws and weaknesses in discipline, and I have mine as well. But one of mine has never been like not exercising. I like exercise. I've always been inclined to it. I've done a lot of martial arts and a lot of yoga, light yoga, aggressive yoga. I like running. I like resistance training. I like it all to some degree. I think I like very active and strong exercise. I think what your program, this sort of like teaching movement regulation, is the yin to the yang that is the exercise that we are all familiar with. And like my opinion, like I've said to you off the record before, is that it is absolutely necessary to prevent like long-term injuries or long-term deterioration, because I like hard exercise, but I think without doing movement regulation, without doing these very refined, intelligent forms of physical therapy, which, like, you can correct me on the phraseology of that, but that's the way I see it. I see it. My experience of it was like the Harvard of physical therapy, instead of just getting like these like generic prescriptions and just like, oh, you need to strengthen your quads or whatever. It was like this very specific, like getting into like the subtlety of each individual joint, and like how to learn how to care for it, and not just make ourselves have great strength and stamina, which I think are good things, but without the opposite to that, which is like you guys provide the opposite to that, the balance to it. And so without the balance to it, it's like I think we're doomed. You know?
Yeah. I like that. I appreciate it. I may take that. The Harvard of physical therapy. That may be our new slogan.
Yeah. You're gonna have to dress differently.
Yeah. Awesome, man. Thanks a lot. You have to the Brooks Brothers. I gotta go.
Yeah.
Cool, man. Thanks so much for taking the time out. We appreciate it, and look forward to continuing to work with you, man.
Nah, thank you, bro. All right.